Breast, of course, is, that it is considered that it's one of the secondary sexual characters or characteristics, and it is what we call it feminizing character in a female patient. Why am I saying this actually? Because when a disease affecting this organ, it will be actually, you will have a response from the patient or a feedback differ from other kind of diseases. خليك يعني أضرب لكم مثال حتى in order to understand what I'm talking about. Actually, suppose that you have a patient with pain in the right hypochondrium, and it occurs after having heavy fatty meals, these things, and the patient having flatulence and dyspepsia and some sort of indigestion, and then for a long time it will be relieved by simple analgesic and these things and those things, and then you request for the patient an ultrasound and you discover that there is a gallstones, okay? And you tell the patient that you have a gallstones, you need a surgery to remove the gallbladder. The patient will be happy because she knows that this is the end of her problem, okay? يعني راح تعرف انه هاي المشكلة مالتها هاي عرفت شخصتها انت انحلت, okay? She will be happy. She will cooperate with you and she will accept surgery right away in most of the cases because she knows that there is a problem to be solved or to be fixed. In case of breast, things is different, okay? Once a patient having something in the breast and then you discover there is a mass, and then you tell the patient that you have a mass, you need to do some sort of biopsy, whether needle biopsy or excisional biopsy, whatever it is, she'll be scared, she'll be fearful. Why? Because of, as we said, that it is part of the femininity of a female. Okay, and the second thing that, as you see in the next slide, that a lot of mysterious stories. شوف هسه نقول لك دكتور بنت عمي نفس الشيء صارت وعندها هذه اخذوا من عندها عينه وتلوث الثدي وشالوها ورا 6 اشهر توفت. Okay, بنت خالتي هيجي وحده سمعنا هيجي. So there are a lot of stories, maybe false stories, maybe, but it is the reaction of the patient is not like that one with the gallstone. Okay, understand? And the gallstone, she right away she got happy, and then she accepted surgery. Here, you will find the patient's reluctance, متردد, scary, fearful. She will not accept anything, and she will feel that this is not the end of the problem. She will feel that this is the beginning of the problem. بالنسبة لها هاي بداية المشكلة. Okay, because she will know that, or she knows that she will spend a lot of time doing these procedures, those procedures, surgery, and there is a possibility that she may take a chemotherapy, radiotherapy. Okay, so be careful when you are handling a patient with a breast problem, because as I told you that the approach should be different from any other problem, even when it is benign. حتى لو كانت you are sure that's fibroadenoma, you will find the patient is not easily managed or easily handled. She may refuse from the first time even to remove that anything. Anyhow, so the second thing that the patient, the breast is important, is that the target of multiple hormones, as we will see later in the next slide. And then lastly, the breast is considered as an exocrine gland, okay? Because it's needed due to breastfeeding, during breastfeeding, and so to produce feeding for the coming child. So this thing I mentioned already, that about the mysterious things or mysterious stories that the patient will tell you, and these stories prevent her not to go easily in that path. Okay, ولهذا يعني احنا عادة من when we are disclosing information for the patient, we should not disclose all the information. We have to be careful. يعني انت ما يصير تقول للمريضة انه اكو احتمال عندك مرض خبيث. Don't say these things unless you have proof, biopsy or something. Then you can counsel the patient and tell her in a proper way that you have this thing. Okay, but always, unless there is an absolute proof, don't say. Always make the things still need more study, still need more approach, more procedure to find the. Okay. For the next, as I say, that's a target hormone. There are multiple hormones which act on the breast. Okay, and of these hormones, which is a well-known hormones, is the estrogen. And estrogen actually, it's responsible for stimulation or proliferation of the ductal system, of the duct. Okay, so it is a duct, and of course, and somehow it is responsible for the accumulation of fat in the connective tissue to give the sizable or the size of the breast. And that's why we are saying this, because estrogen is important in the development of the breast. Okay, because you know that when you say that now she's mature female, then you will look for some other features of, and one of these features is development of the breast. Okay, right. So we have the progesterone. The progesterone actually, it is not for the growth rather than for the function now, for the function of the breast. So that's why progesterone is responsible to stimulate the formation and maturation of the glands, forming or milk forming glands, which is the acini, which is the basic unit of the breast. Okay, so it is related more to the function, not to the growth. Progesterone. The other hormone which can be involved or can be at the breast is a target for it is the prolactin. And I think all of you familiar what prolactin will do. That prolactin is responsible for actual production of the milk. So progesterone for the cells, now prolactin will come to produce the milk. And what hormone will cause expulsion of the milk is oxytocin, okay, which is stimulated by baby by sucking the nipple or whatever it is, okay. So it triggers the contraction of myoepithelium, which is found at the alveoli or the acini, in order to expel this milk, which is already formed by prolactin. Then there are other hormones, secondary hormones, which is not maybe it's not always present, like what we call the human placental lactogenes. This is produced by placenta. So it is produced only when the female or the mother is pregnant, okay? And it is responsible again with other hormones to prepare the breast. Because it's lactogenic, so it's prepare the breast. It probably enhance the protein for the breast, for the formation of, for the factory. Is the main primary products for the factory, which is the breast, to produce milk. So that's why they call it lactogen, sorry. And then lastly, we have a variety of hormones which is not specific actually, rather than it is supportive, like a growth hormone, like insulin, like growth factor, like thyroxine hormone, even involved in this process. And all these hormones, it works with synergy with estrogen and progesterone to promote the overall breast growth and development during puberty and pregnancy. Okay, so these are a secondary hormone, as we say. Then, what do you expect that a patient with a breast disease will come to have? Of course, as usual, that the history of a patient with breast disease is that, as usual, is a chief complaint to start with. And the chief complaint of a patient with a breast problem, it could be a pain, which is the most common one, and we call it mastalgia. And this mastalgia or this pain could be cyclical, could be related to the menses, or it could be just has no relation, or non-specific, it has no relation. Okay? It could be a lump, the patient, notice a lump there. It could be a nipple problem, like discharge, scratching, itching, whatever it is. And or there is a swelling, obvious swelling in the breast. The duration, of course, the duration of this chief combat, as with other diseases, you remember that we say that sometimes you may have a pathology which is complicated, like a hernia. Hernia موجودة من 6 أشهر but صارت painful for the last 2 days. So the duration is 2 days, right? But the history of presenting illness, yes, date back to 2 years or whatever it is. This is the same for the breast. Could be acute, it happened just now, like pain in mastitis. واحدة بدها ترضع ما صار لها يومين بدها تصعد فت severe pain. So this is not a chronic problem. Or it could be some sort of fibroadenosis which presents since long time with each menses, but this time it's before menses with 2 days she is having this pain. So duration could be acute or acute on chronic. Then the history of presenting illness, you will discuss what happened. And then relation with the menses, relation with other things. If the patient is pregnant, if the patient is breastfeeding, you have to clarify the state of the patient in order to, okay? In the review of system, of course, you will start with the genital system, okay? You remember that we say that in case of appendicitis, we start with the urinary system. Here it's better to review mainly the genital system and the parity, and you have to mention the miscarriage if presence, if the patient is of course as married. And then again an important factor, which is, what is? Family history. Family history, because all you know that breast disease, mainly breast tumor, is familiar. It has a very, very strong familiar tendency. So you have to mention the family history of specific tumor in that. Not only breast tumor, any other tumor. Okay? Then, here I would like just to mention for you how it will come in the examination for you actually. Because now your examination, I guess that it is an OSCE kind, right? So an OSCE kind, you will not have a patient. You will, maybe you have a simulator or you have, but you will be given just a paper, and then the paper asks you how you will examine a patient with a breast mass, okay? And then you have to mention. And this kind of examination is, we call it focused examination. And focused examination, then you have to mention things related to that pathology. Why? Because each thing, as I will show you the list, checklist تسجيل الممتحن يما وموجود بها what things the candidate should ask حتى ينطي درجة. if you will not mention that thing, then you will not get mark. يعني مو مثل مريض انت اذا يشوفك تقول له نشوف اكو any abnormality, anything, then he may evaluate according. No, there is a specific thing. If you mention that thing, that question, or that information, then you will get mark. If you will not mention, you will not get a mark. So to start with the steps of examination, keep in mind, I think I told you last time, that there is things that you will do every patient for, not only breast. And these things you will get mark for it, at least for 6 mark for these things, okay? The first thing is that you wash your hands and you put any personal protective equipment if it is needed, of course, okay? Either gloves or you put a gown, whatever it is. And then you introduce yourself to the patient and your job, your role, what you will do in a proper way. Then you confirm the patient's date and birth and name of the same patient, and then briefly explain for the patient what you will do. حتى المريض لا يحاير ما يعرف شو يسوي. You have to explain that I will examine your breast, okay? I will try to find what's wrong with there, okay? Then, of course, before starting the examination, as we say that always, whenever you are examining a female patient, you have to ask for chaperone, somebody who is accompanying you during the process of examination. And the chaperone, it could be a relative of a patient, or it could be one of the female medical staff. And then you check if the patient understands. You should try to ask the patient if there is any question about the procedure. Then you just ما تعرف يعني شو تشرح تسوي. But just to be sure that if the patient understand what's the procedure will be, okay? And then the other thing, the sixth steps, you gain the consent of the patient, verbal consent عادة احنا نقول, because this is not a procedure. احنا اكو for certain things, مثلا endoscopy, proctoscopy, you have to have a consent, informed consent. But this procedure is a part of general examination, so express consent is enough, verbal consent. يا بتقبلي والأقبل, that's all. This is a consent, okay? These are these things which I mentioned just now. It is applicable for all kind of examination, okay? فهاي لازم تحفظوه حفظ عن ظهر قلب مثل ما يقولون. You have to learn it by heart, because you will use it in every examination. وكل هاي تاخذ عليها درجة, يمكن تاخذ 6 من 25, and this is a good percentage, مو يعني تنجح وترسم. فهاي خلوها عندكم دائما, يعني always you have to repeat it whenever you are coming to the patient. You do the same thing. Okay, so now with the of course with the chaperone, you secure the position of the circumstantial patient by closing, okay, by closing the curtain or drawing the curtain. And then you will choose the suitable position. This is still in the general. You choose a suitable position, and you remember that we say that the abdomen, the best position or proper position is supine position. In thyroid, it is sitting position. In case of breast, actually, there are a lot of positions. What position you mention is okay. If you want the patient, it's upright sitting on the edge of مثلا هاي الثدية وتقعد على الإيدج مالتها. If you want the patient semi-recumbent على البody, even lying position sometimes you may use. So all these positions are accepted for examination of the breast. These are the sitting on the side, semi-recumbent or reclining position. And then you will come to the other thing, which is exposure. And exposure, you are talking actually reasonably that you should expose the sound one and the diseased one. But sometimes it may be difficult. So you may take a look to that one, or you ask her if there is anything abnormal. But actually, this is the usual thing. You have to expose both breasts in order to assess something else during inspection. Okay, and then after exposure, that you ask the patient the usual question. You remember that whenever you will start your examination, you will ask the patient what?
Pain.
Yes, exactly. What's the pain? Specifically when the patient is not operated on. So just ask the patient what's the site of pain in order to examine just away from that side. And another here and exactly in the breast, you ask the patient the site of the swelling or the lump she felt. لما مرات تجي هي والمريضة أحسن من عندك لأنه أكيد شايفة فحص نفسها فد 4-5 مرات وعارفة المكان مالها. Okay? So in order to spare time, you can ask her where's the site of the lump you already felt. تقول لك outer quadrant, upper or lower, whatever it is, in order to make the things easy for you to examine that lump حتى تصل الدور, because sometimes it's very difficult if it's specifically if it's a pendulous breast, it's very difficult to feel the lump. Okay, but the patient will localize it exactly because she already examined herself. Okay, then we'll come to inspection. That thing is just the general procedures, all these things. Then we will start the examination. In the examination, the procedure, you will look for scars of previous surgery. You will look for asymmetry, as we say that we are exposing both breasts. But keep in mind that asymmetry of the breast is a normal phenomenon. Almost all female or women, they will have asymmetrical size of a breast. So if you will find asymmetry, it doesn't mean that this is a pathological condition, okay? And then you will look for any obvious mass. Sometimes you may have a swelling or obvious mass, as I will show you in the slides, okay? And then you will take a look to the nipple, because it is just like the umbilicus and the abdomen. You look to the nipple. If there is any abnormality, is it everted? Is there any scaling? Is there any ulceration? Any discharge without squeezing on that nipple? Okay? And then you will look to the skin of the breast. Is it changed? Is it normal? Like erythema, puckering, podorange, or dimpling, or whatever it is. Okay? And then you will come to palpation. The palpation of the breast, you start to palpate the breast usually by palmar aspect of the finger, and by using two hands. One hand is supporting hand, and the other is examining hand, in order to just look for any tenderness, any mass. And during this palpation, of course, if you will find a mass, then you have to mention the size, the texture of the mass. Is it tender or not? It is firm, is it hard, is it soft, is it mobile? Sometimes fibroadenoma, we call it mouse of the breast. I mean, yeah, mouse of the breast, gummus phenomena. You may not, may be difficult for you to localize the size, because once you press it, then it will slip to the other side. It's freely mobile, okay? And the surface, the edge, and then relation of two things to this mass: the skin and the deep structure. In the skin, you can easily pinch the skin or push the skin to see if it is tethered to the skin, if it's attached to the skin, which is one of the signs of malignancy. And in the deeper structure, you can ask the patient to do certain maneuver by, yes, but the best thing maybe is that to ask her to press over the thigh, right? To contract the pectoralis muscle. And if you will find that mass now not moving, it means that's attached to the deeper structure. But if this maneuver doesn't affect the mobility of the mass, it means it's not attached to the deeper structure. Okay? So you ask the patient just to put it. Of course, there are other maneuver, of course, to be done during palpation or even during inspection, is that to ask the patient, in addition to put or to press over the thigh, is that to raise the hands over the head in order to see the relation of the mass with the skin, okay? Then, in order to complete the palpation, you have to examine the nipple. An examination of the nipple is that you try to squeeze the nipple to find if there is any abnormal discharge from nipple, whether serous or blood or whatever it is, to notice any discharge from there. And then, as a part of examination of breast, is that to examine the axilla. And the axilla examination, actually, I will show it in the slides, either to use the right hand for the left and the left hand for the right, okay? Or use the right for the right and left for the left. The maneuver is there, but the main thing is that you have to palpate all the groups of lymph nodes. It's the medial one, which is the anterior and posterior, sorry, the medial one, anterior and posterior, the lateral one, and the apical, and the central, and the supraclavicular lymph nodes. All these lymph nodes are related to the breast. So all these groups should be examined. And then you complete the systemic examination for any evidence of organomegaly. You will examine the liver, you will examine the spleen in order to see if there is any evidence of organomegaly. And you have to mention it, okay, during the examination. You have to mention as a complementary to complete the examination of the breast, you say that I will examine systemically in order to declare any evidence of organomegaly if it's present. Okay, right. So this is the list which will come in the examination.
Okay, you can see that. This I did mention it in the explanation. Agree the patient, seek for chaperone, obtain verbal consent, be sure your hands are warm. Of course, you don't need to put it in sequences. يعني انت مش ممكن تخلي واحدة قبل الأخرى. But you have to mention almost all these things in order to gain marks for this thing. Okay? And then of course you examine them, compare. By the way, يعني هذا مو انه دا غششكم بس هي موجودة بالنت يعني انتم if you will just take it or Google it, then you will find this checklist. Okay? يعني مو شرط الا ينفذ الامتحان, but this is just a sample of it. Then during examination, as we say, that's the symmetry, the size, nipple, and any discharge, and engorged vein. If there is engorgement of vein, there is a skin changes like in mastitis, okay? And note if there is any dimpling, nodularity, discoloration, ulceration, podorange, or any scar previous surgery. We already all mentioned all these things. And then you inspect the arms. This is an additional thing in this checklist that you inspect or you mention if the arm having any swelling due to lymphedema, okay, which is an advanced condition in case of CA breast. And of course, as I say that you inspect while the hand is resting at sides and the arms rest above and the palm placed behind the head, or the patient leaning forward as your colleague mentioned. Okay, and then the palpation start with the normal side first. You will palpate and palpate gently by the fingers all the region of the breast, including the axillary tail and the axilla. And if the mass is present, then as I mentioned to you that you have to mention whether it's standard, the size, and the relation to the structure, and all these things. And then lastly, last part of this checklist that determine the relation of the mass surrounding tissue to the skin, to the nipple, and to the chest wall or the muscles. As I told you that you ask the patient contract the pectoralis to see if it's fixed to the pectoralis or not. And then you palpate for supraclavicularis as a part of lymph node examination and examination of axilla, and then squeeze before that, squeezing the nipple to see if there is any discharge. And post-examination, this is, you have to mention again here. Just keep in mind that you have to say that you ask the patient to dress, you thank the patient, and cover the patient, and you explain for the patient your finding in a simple language, but don't give a diagnosis, okay? There is no way to give a diagnosis on this set of examination. No, you have something we want to do more procedure in order or more workup to figure out what's going on, okay? And then instruct. This is actually, if you see here, explain and demonstrate breast self-examination. This is for an outpatient. If the patient doesn't have anything, okay, والمريضة راح تطلعها. In order to just a part of follow-up, give the patient instruction about this maneuver, which is breast self-examination. هي موجودة بكل مكان، كل العالم الآن. Okay, that they educate the female patient to examine herself by herself, and if she discover anything abnormal, she can consult to the breast clinic. Okay, so you can mention it. If you didn't mention it, there is no much problem, and then you instruct regarding the follow-up. Okay, right. So that was just an introduction for how you approach an examination of the patient, and practically when you have breast pathology, you have to specify or localize what is that thing. You remember in the abdomen, we have the surface anatomy of the abdomen is divided by 3 lines or 4 lines.
4 lines. Yeah.
By midiclavicular line,
Subcostal.
linguinal, and costal or subcostal with the anterior superior spine. This divides the abdomen into 9 regions. Okay, 2 lumbar, 2 iliac, right and left, and 2 hypochondrial and periumbilical and epigastric and hypogastric. In that one there is a lines, there is anatomical landmark in order to divide. In the breast, of course, there is no landmark actually to divide. But you can draw two lines here like this one. One is crossing transversely the nipple, and the other one is longitudinal, and divide the breast in these quadrants. Medial 2 quadrant, lateral 2 quadrant, the upper and the lower, okay? In order to localize or specify the site of the pathology when you are talking. حتى من تحكي وتكتب بالكتاب مالتك, there is a mass in the upper inner quadrant, okay? Or there is a lump there, or there is whatever it is, tenderness there. And don't forget that the upper outer quadrant included with it the tail of Spence, or the axillary tail of the breast, which is an important part of the breast because it could be the site of the tumor there, okay? So this is the surface anatomy of the breast, how we will divide it. انتوا عندكم بالهذا بالعشرة ونص مو؟ عندكم سمينار؟
سيمينارات اليوم؟
ايه؟
نعم.
ما عندكم؟ اوكي. زين جيد ذيش الاربعاء مو هاي قبلها. من التسعة ونص دكتور عندنا سمينار دقيقة اوكي. So, right. This is the way how do you palpate the breast. As I told you, that use two hands. One hand is supporting it, and the other one is to palpate. Usual palpation is by palmar aspect. And this is how to examine the axilla. Okay, the axilla. You can see that the right hand for the left side, and usually it is done just like that. I will put my right hand here, and I will ask the patient to rest her hand over my hand, and I will catch my left hand and examine my right hand. Okay? حتى the way I'm asking the patient to rest her hand over my arm in order to get the things relaxed. حتى لا تخلي المريضة هيك رافعة إيدها. This is not the usual way of examination. Try to put a rest for the patient arm حتى in order to gain the axilla or the muscle of the axilla relaxed. حتى تصير palpation مالتك easy and informative. Okay? So always ask the patient to rest her hand over your arm while you are examining in order to get these parts relaxed. Okay? And you examine anteriorly, as I said, posteriorly, and medially, and the apical, and the central.
Can she rest it on the shoulder?
Which one?
Can she rest her arm on my shoulder? No, it's not acceptable.
It's not acceptable. It's not suitable, actually. It may be done by some other people, but it's not the suitable things. The most convenient thing is that to rest her arm over something, you will get the arms or the axilla is relaxed. Okay. Here is, you can see that it is the right hand for the right side. شوية عكسها, بس you can notice here that he is holding the arm of the patient. Okay, now he is holding the arm of the patient and he examined the axilla, the right for the right. So it makes no difference about the way of your examination, which is convenient for you, for the patient, you can do it. There is no restriction for one mode of examination. Okay, these are the group of lymph nodes, which is we mentioned just now. It is here that this is the medial, the anterior, and the posterior. Okay, and then this is the lateral, which is we call it maybe axillary lymph nodes because of the axillary thing. And here is the central, which is in the pit of the axilla there, central. And then you have the apical. The apical actually, it is between the medial third of the clavicle and the head of the pectoralis minor. يمكن راح تقولون هاي شلون احنا نقدر نعرفها. It's easy actually. If you will put your hand here for yourself, it is the most lateral third of the clavicle. Just below it, it is the site of that part of the apical lymph nodes. Okay? Let's تشوفون هاي الclavicle. Just below it, and you can feel even there is some sort of muscle there. Anyhow, in this pit is the apical group of lymph nodes. And this is the supraclavicular fibrosing. So it's easy to localize, okay? Right. Here, there are certain things which is easily can be noticed. It's a lump. Sometimes a patient will present with a lump, although it's not usual thing this, but she can present with a lump, obvious just like that. بين ظهر اللump, okay? Specifically when it's superficial. This is a lump. But you can notice that the skin over it is normal. There is only elevation, but the skin is normal. There is no change in the color or the texture of the skin, which it seems that's most probably a benign thing, okay? The other thing that you may notice, which is, again, you can call it as anatomical variation, which is axillary tail, exaggerated anatomical variation. This is what we call it the axillary tail. Is that the extension or part of the breast to the axilla. And actually why it is clinically important, because it is in the abnormal side. And the abnormal side here is that the patient always pressing over that tissue, okay? You remember that the axilla is empty, مو؟ axilla من واحد يباوع عليها. axilla من البوردر لاين مالتها anterior, posterior, medial, lateral. It is empty. Why? Because it will give space for the movement while you are moving. But if it is full by some sort of soft tissue, then it will be difficult to move. And that tissue will be compressed all the time. So it will be subjected for a variety of problems. Pain, congestion, infection, whatever it is. So sometimes even the patient asks you just to do some sort of reconstructive surgery in order to remove this extension. But just keep in mind that when you find something like that, it is axillary tail of the breast, is a breast tissue, okay? And sometimes it is the site of malignancy there. Here is another pathology you may find, which is all these are benign, retraction of nipple. Retraction of nipple actually, it could be a benign phenomenon. It's not always a malignant one. And the factors which support the benign nature of the nipple retraction is these, that you have a long standing history of retraction. يعني تيجي المريضة تقول لك أنا هاي من عمري 12 سنة، والدتي كانت تقول لي هاي هيك موجود، زين؟ ولحد الآن هو مستمر. فإت means most probably that this is benign. This is some sort of either infection occurring at that time, or it be congenital, or it be something else, but it's not a malignant one. Okay? So a long-standing retraction, this is in favor of benign nature of retraction. Another thing or another factor which is supporting the benign nature of retraction is that absence of underlying mass. When you will find retraction of nipple, but you cannot feel a mass, either by feeling or by sending the patient for mammogram, as I will show you here. Then, the third factor, which that there will be resolution of this retraction after certain process. يعني المريضة يمكن تيجي تقول لك أنا نفس الشيء صار عندي قبل سنة، بس صار الثدي مالتي التهب. There is a pain, there is a fever, but when I took some sort of medication and all these is relieved, then the nipple return back to its normal condition. So it means that inflammatory process or infective process causing this retraction. So resolution after addressing the underlying cause. This is another factor. Whenever there is a factor which causes retraction, it is relieved. So retraction is relieved, it means that a benign, most probably a benign. Okay. Then the fourth thing, it may be always the benign one is a horizontal one, a horizontal retraction. You will find just a slit-like opening of that nipple. Okay, and then in addition to that, there is no skin change of malignancy like dimpling, as we will see there. Okay, and the most important thing of all these things, if you will find the retraction, bilateral. If it is bilateral, this is very, very unusual to be malignant. And very rare to have malignancy on both breasts, although there is some kind of malignancy like lobular carcinoma that happen bilaterally, but bilateral retraction is not recorded out. Okay? Right. Then benign harmless causes of retraction. This is a cause, it's not a factor actually. Okay? That you may find retraction in such a group of female which can be considered normal. Like, which is, many people simply have inverted nipples as a harmless, long-standing characteristic. It's a presence, and the cause is not obvious, but it's present since 20 years. Don't bother yourself. If it's present for such long time, without a specific cause, it's a natural thing. Okay? احنا اللي يهمنا انه that this retraction is a secondary feature of malignancy, right? But if it is since 20 years, so don't bother yourself about it, okay? Unless it's caused some sort of complication. If the patient complaining of repeated infection, because you know, when there is a retraction of the nipple, it means that the opening of the lacteals or the ducts on the nipple will be kinked. So all the debris or the secretion will be trapped inside. So this is a predisposing factor to which we call, what was that, sorry?
Infection.
Yes, infection and cyst formation, all these things. So if this happen, then you can suggest some sort of plastic surgery. عادة نسوي some sort of plastic surgery, piercing suture, حتى نطلع النبل اللي فوق. Otherwise, you can leave it without any harmful effect. Another cause could be that aging process. Sometimes during age, over time, that the nipple will be retracted or inside. And then mammary ductal ectasia, that this is non-cancerous, condition that, involve the widening and thickening of milk duct, as I said, that because of the blocked and kinking of the ductules will lead to this duct ectasia. An infection, an abscess formation in the gland and the area, though rare, can also cause nipple retraction. These are things which is a natural things, malignant causes of retraction of nipple, which can be ignored. All, okay. This is the feature of a benign, as I told you. You can see that it's just horizontal slit, okay? Horizontal slit, this is the kind of retraction. And even the skin, although there is some sort of elevation, but this is normal thing. But there is no dimpling, there is no change in the skin, no podoragia, in order to say that it could be a malignant one. This is another thing that of nipple retraction. You can see it's a slit-like, and these are the mammogram of each breast. You can see that the mammogram is free of any mass. Okay, we say that when there is no mass, clinically or in mammography, that most probably this retraction of nipple is a benign one. Then, of course, from all that causes and that factor which support the benign nature of retraction, there are factors which raise the suspicion of malignancy. When you see that factors, then you have to think that you are dealing with some sort of malignant disease. Okay, so you have to be careful. The patient should have further study. And of these factors is that when the nipple inversion is a new. تيجي واحدة تقول لك أنا قبل 6 شهور ما عندي هيك شيء، بس هاي خلال هاي 3-4 أسابيع لاحظت إنه هذا nipple started to retract to the side. So it's a short history. This is raise the red flag, okay, with a great suspicion. The second thing that the retraction is rapid in its development. قبل اسبوع ما كان هيجي، هسه هالاسبوع هذه صار كلش retraction للداخل. So progression, rapid progression of inversion. And the inversion is only one breast, it's not bilateral. Again, this is a supportive evidence that the retraction may be due to underlying malignancy. And then you notice associated symptoms like a lump. We say that retraction without a lump. Or you notice that skin thickening or dimpling or tethering or puckering, whatever it is. Or there is a nipple discharge, abnormal nipple discharge. So all these things factor raising the suspicion of malignancy. So just keep in mind that if you have these specifically the history, if it is a new, rapidly progressive, it means something else. It's not a normal one, right? Yeah. This is how the malignant,
Zero.
retraction is. Yes, exactly. I think all of you notice the podorange, no? Dumpling. It's obvious, and even the retraction is not like the benign. It is something pushing all the nipple. It's not like just slitting the nipple. No, it is pushing or pulling the nipple to the inside. Something pulling the nipple to inside. This retraction with this dimpling, definitely it's not a benign feature. It's a malignant feature. This is another one. Again, you can see that obviously there is a dimpling and this retraction of the nipple. It's obvious the nipple is still there, but it is pushed to inside, and you can see if you will push the skin, the skin is not normal. It seems that thickened. And this thickening is because of, that edema of skin which caused the dimpling, which is part of malignant process. So this is how the malignant retraction appear or look. And this is, you can see, it is a mammogram with a mass. So definitely, if you send a patient for mammogram, and specifically the patient after 40, because mammogram is not useful, was not informative before 40. Okay? Before 40, usually you send for ultrasound. So you can see that there is a retraction, but there is irregular. Obviously, you can see that there is irregular mass here. different. تذكرون اللي شفناها قبل شوية الماموgram was clear. With retraction, it's a benign, but this is definitely an abnormal. This is another mammogram which shows the retraction is there, even in the mammogram, but there is a mass here. So this is the mass. Right. There are two things you may find in a little bit advanced CA, advanced involvement of skin. And these two things, what we call puckering in here, and the tethering. Puckering, it means that the puckering, difference between puckering and tethering, puckering is to be seen. That you saw some pocket there. That the skin is dimpled down, a big dimpling. But tethering, it's by palpation. Tethering, it means that the malignant process is starting to attach to the skin. So the skin, if you want, or if you would try to pinch the skin to separate it from the underlying mass, it will not be. And simply by doing this maneuver, this is a puckering. You can see, this is the puckering, and this is the tethering. This is maneuver how you elicit the tethering. That you push the skin, you can see that the skin is not like the normal one which would make a folds, simple folds. But it seems that the skin as if it is attached to something below, okay? So it is not easily folded. This is what we call tethering. It's just like here. So when you push it, it's not folded easily. This one specifically at this side is not folded. It's folded on beyond this one. So tethering, keep in mind, tethering is that elicited by palpation, while puckering is to be seen. And both of them is a sign of malignancy. And then we will come to another features of breast which you may find is that the redness. This is an obvious picture of a breast with mastitis. And mastitis is, you know, that inflammation of the breast. And the most common time of mastitis to occur is usually on yes, breastfeeding, exactly. Breastfeeding. It can, of course, occur without breastfeeding, but it is most commonly during breastfeeding, and it comes from, they say that it comes from the baby, because when the baby sucks this nipple, that there will be negative pressure inside the breast. So when they withhold the baby, or the baby leave the nipple, then the nipple will suck inside the secretion from the mouth of the baby, which is retained on the nipple, and presence of staph and streptococcus will enter inside the breast, which is a good culture for infection. So that's why they said it comes from the baby. Anyhow, this is not, but what concerns us is that the feature of these, and one of these features is that swelling and redness, which is obvious in here. And of course, in addition to the pain, fever, malaise, and it is the most one of the most common causes of malaise and infection of organs, which is the breast. Why? Because the breast is abundant with the blood supply. Okay, so easily bacteremia and toxemia to occur. Okay, this is another. I think this is another more clear. You can see that there is engorged veins, redness, and even scaling start to happen. This is another case of mastitis. Mastitis, of course, how do you follow mastitis? Of course, mastitis, the treatment of mastitis, what is it? Yes, exactly. The first thing is that it is composed of medication and instruction for the mother. From the medication, as you said, antibiotic, and the antibiotic to be chosen according to the most common microorganism causing the disease. And the most common, as I said, is staph and strep. So you have to give antibiotic like cloxacillin, which is acting on these strains of antibiotic. Okay, of course with analgesic, but an analgesic with other kind of medication which is needed, and you have to choose analgesic which is not affecting the baby. Okay, be careful when you are giving analgesic; it should not affect the baby, and it's indicated, or it is not of harm during breastfeeding. And the general instruction for the mother is that to evacuate the breast. Okay, لأنه مرات they will advise her that she should not breastfeed her baby from the breast. Yes, يعني تعطي ترضعيه للطفل لأنه المضر. Yes, you are right, but you have to evacuate, because without evacuation it will exaggerate the things. It will make the things worse. Okay, so while we are treating such things, we are expecting two lines or two paths for this disease. The first path, that there will be relief, recovery, تصير زيادة. Okay, redness يروح, even the color of the milk will return back to normal, fever will disappear, pain will, or it may be another path. What is it? Yes, exactly. Abscess formation. Okay, so that's why whenever you have the temperature is still there, continue, and they start to be hectic temperature, ندخليها برا راح تسوي لها chart على الأقل يجوز 12-hourly chart or 6-hourly chart, and you start to find that the temperature is hectic. تجين عليها كل 6 ساعات شوية زينة أمورها تسعرك، وبعدين ورا شوية temperature will increase. We call it hectic temperature. This is a sign of abscess formation. Exactly. So what investigation you will send?
Ultrasound.
Exactly. Ultrasound. This is the ultrasound of a patient. Sorry. This is the ultrasound of a patient after massage. You can see obviously that there is a collection happening there inside. Okay. So once there is, and still we are treating conservatively, right? Medication, instruction, these things. But if there is an abscess collection inside, it means that there is no way other than drainage of that abscess. You have to drain that abscess. And usually drainage should be done under general anesthesia. And you can see here clearly that the abscess is drained and there is a corrugated drain put inside. Okay? So if the path just shifted to development of breast abscess, right? Now we will come to another condition you may face during practice, is that what we call it? Exactly, gynecomastia, which is presence of enlargement of breast in a male. Usually the male is teenager. And this is what we call pubertal gynecomastia. It is because of imbalance of hormones. Because you know that everybody having, during early period of growth, there is estrogen and testosterone. But when there is increase in the concentration of one, it will affect that. So in these cases that the breast is exposed to elevated level of estrogen. So what's important of this thing is that it is temporary thing. This imbalance between hormones is a temporary. Once the pubertal stage is finished, then everything will be settled. So what importance meaning of this thing? لما نعرف أنه this is a temporary, it means that this is a way to tell the patient or to assure the patient that this enlargement is, or this will disappear by time. It may take weeks, months, even sometimes 1 year. I mean that just to assure the patient, assure the family. لأن يجون عادة الفاميلي, they are worried, they are considered that their child يعني شوية حتى نفسيا ها.
إذا أكو genetic disease يعني family خايفين لا أكو genetic disease.
Yes, not only this actually, but even the child. يجي واحد عمره في 15 سنة يستحي يطلع بالرياضة مو؟ أو يروح للمسبح، يعني كلهم الجماعة يباون عليه ويشوفوه. It will be embarrassing thing actually for the child أنه يشوف هيك الثدي مالته وجماعته لما يشوفوا يحكوا. Then he will ask the family for a solution. So that's why the family is so much concerned, because the child is anxious about the thing. So what you need is that to assure the family that this thing that will disappear by time. Although it may take a long time, but it definitely will disappear. And this thing that could be unilateral, could be bilateral. Okay? And it is because of the effect of estrogen mainly on the breast. To produce more, what kind of elements with genital estrogen? Tubules. Well, you don't find a gynecomastia which is producing milk, right? It's just enlargement, it's the growth of tubules. And this factor or this character or this feature, is characterized or giving the diagnosis of or differentiate between the true gynecomastia and the false gynecomastia. This is what we call false gynecomastia.
Obesity.
Which is, yes, exactly, part of obesity. It's just condensation of fat in that area. So if you will take a biopsy from this breast, you will find adipose tissue. While if you take a biopsy from that one, you will find the breast tissue, which is ductus, perforation of ductus. Okay? So this is the difference. This is related to obesity, but that one is related to imbalance between hormones. So this is important to manage the patient, that if he is obese like that, you can ask him just to reduce his weight. يعني ما يروح إذا متضعف نفسك. But that one, no. He is, you remember that one, he's slim, but there is enlargement only for the breast. So this is the difference. Okay? Yeah. The last thing I think, this thing is, which is maybe rare, you will not always or not usually will face it, is what we call it carcinoma of the breast in male. Okay? Male carcinoma of the breast. And male carcinoma of the breast, actually, it's a very rare disease. It's comprise about 1% of all the carcinoma of breast. واحنا عادة when you hear about case of carcinoma of breast, the first thing will come to your mind that the patient is female. ما حد يفكر أنا male عندها carcinoma وين صاير هاي. So that's why this concept that the male is hardly if ever involved by this disease or getting this disease make the things is a bit tricky for this condition, because sometimes a male with such lesion in here or even here يروح وين؟ عافية عليك. Very good, excellent, good. يروح لأبو الجلدية. أبو الجلدية he is maybe not oriented that there is a possibility of carcinoma of breast. شو راح ينطي ointment, ينطي كريم, antibiotic, تعالي بعد 3 أسابيع, بعد أسبوعين, يجي بعد أسبوعين, he may change the routine or may change the list of treatment, and then wait for another 1 month or 4 weeks, and the process continues. It's not skin disease, right? And then when he will go for somebody else who is more oriented, they will take a biopsy and discover that it's a CA. مرات تقولوا ما يخالف يلا مهم. No, this is not, because he lost a very valuable time because the disease is a rapidly progressive disease and easily to reach an advanced stage. Why? Anybody think why? It's more than female. Anybody can think of reason? Because there is
Hormone.
no, there is no supportive tissue. The female having the breasts, connective tissue, fatty tissue, nidus of malignancy. تريدينها فد وقت حتى تمشي مو وتوصل to the deep structure. يجوز 6 شهور توصل، يجوز سنة توصل. هذا and this one, you can notice here, there's no supportive tissue that the disease or malignant process can reach to the fascia and the muscle easily within 1 week or 2 weeks, and it will enter the blood, enter the lymphatic, and will distribute to the axilla and then circulate in the blood. فيصير من stage 1 إلى stage 3 within maybe 2 months. So that's why I'm telling you that this patient, if he's rounding here and there with the dermatology, بهذا الوقت الديزيز وصل stage 3 الله يجي من الطبيب الجراح. So this is the importance of the disease, that it is a rapidly progressive disease. It's not handled from the first time in the right path, so it will develop this advanced stage, okay? And it is, of course, although it is only ductal type, because in male only there is duct, so it's ductal type, not a lobular or acinar type. But anyhow, it's a malignancy, right? So this is the thing. This is the important thing, that you have to be aware. You have to be careful that whenever a patient who's having this kind of lesion in here, keep in your mind that there is a possibility of malignant disease there, and try to figure out by using certain procedure in order to exclude or confirm. أنا حقيقة it's very rare. يعني من 83 كنت اشتغل جراحة، لا قبلها يمكن قبل فترة only one case شايفة أتذكر بال 84 وراها ما شفت أي case. And by myself I saw the patient and I operated on by radical, and I find that it is the same thing that is penetrating up to the deeper structure. Okay, so this is the clinical impact or the impact of this kind of rare disease, that it could happen or can happen in a patient, so it need to be handled carefully in order to save the patient. Okay. Well, I think this is all what I want to give you today, at least. And if you have any question for the